Assalamu alaikum. Welcome to my channel Pharmacology Made Easy. Today we will discuss about peptic ulcer disease and the drug used in acid peptic disorder. Due to the earnest request of some students, I will discuss the peptic ulcer disease, and then if I get time, then I will discuss about the drugs used in acid peptic disorders. So at first, peptic ulcer disease. Any ulcer that occurs into the lower part of the esophagus, stomach, duodenum. The surgical anastomosis site that adjacent to the stomach, and the ileum that is adjacent to the Meckel's diverticulum is called peptic ulcer disease. Ulcer, by definition, any breach in the continuity of the surface epithelium, that is called ulcer. Or if we say there is a breach in the continuity of the surface epithelium of the stomach and the duodenum, is called the gastric ulcer, and in the duodenum it is called duodenal ulcer. In ulcer that is involved the mucosa, and not only it confined to the mucosa, it also penetrate the muscularis mucosa. In case of erosion, it is only involved to the mucosa. Now, the prevalence of peptic ulcer disease in the developed countries is decreasing. Due to excessive use of Helicobacter pylori eradication, this case are become decreasing. But in case of developing countries, the disease of peptic ulcer disease is become increasing. It is due to the resistance of Helicobacter pylori to different antibiotics, due to intake of bad food habit culture in our society, and thirdly smoking and using of excessive NSAID without any prescription of doctors. The disease is emerging. The in case of gastric ulcer, the male to female ratio is 5:1, and in case of duodenal ulcer, the male to female ratio is 2:1. So gastric ulcer and duodenal ulcer is increasing in developing country. In Bangladesh, it is so much increasing. What are the important causes of peptic ulcer disease? The first important cause of peptic ulcer disease is Helicobacter pylori infection. 90% of the gastric ulcer is occurred by Helicobacter pylori infection. 70% of the duodenal ulcer is occurred by Helicobacter pylori infection, and 30% of the duodenal ulcer is occurred by using aspirin or NSAID. The second most important cause of peptic ulcer disease is aspirin or NSAID, and the third most one of the cause is smoking, and the fourth cause, and it is the spicy food, excessive intake of spicy food, and also the stress, the causing ulcer in our society. So what is the pathophysiology of peptic ulcer disease? In case of duodenal ulcer, there are 5 important pathophysiology that is important for developing duodenal ulcer. One is depletion of the antral D cell, and that's why the somatostatin is not released from the antral D cell. The second thing is the stimulation of the antral G cell to secrete much more gastrin, that stimulates the gastric parietal cell to secrete the hydrochloric acid, and thirdly excessive secretion of the hydrochloric acid, and fourth there is a increased acidic load or increased acidic chyme in the pylorus part of the stomach that enters into the duodenum and causing the duodenal ulcer, and finally the excessive inflammation and fibrosis may produce dangerous effects of peptic ulcer. These are the 5 important causes of duodenal ulcer. And the important causes of gastric ulcer, it is Helicobacter pylori infection. How Helicobacter pylori causes peptic ulcer disease? The first of all, the Helicobacter pylori is a gram-negative bacteria. It is helical in shape and it has flagella. The many virulence factors are involved in Helicobacter pylori. One of the important virulence factor of Helicobacter pylori is VAC-A gene and CAG-A gene, and also it secretes some enzymes, that is adhesin, and also some enzymes it is secreted, that is oxidase, catalase, and especially the urease. This urease converts the urea into ammonia and carbon dioxide, and when it secretes, Helicobacter pylori secretes urease. It converts the urea into ammonia and carbon dioxide. When it produces ammonia in excessive amount, it changes the pH of the stomach, and that's why Helicobacter pylori is sometimes inhibit the hydrochloric acid formation, and that leads to atrophic gastritis. This atrophic gastritis may turn into dysplasia, first time anaplasia, then dysplasia, and produce the gastric carcinoma. Helicobacter pylori not only involved in producing gastric ulcer, it also produces gastric carcinoma. The second pathophysiology of Helicobacter pylori is Helicobacter pylori is a so dangerous organism or so dangerous bacteria, because we know that our hydrochloric acid is bactericidal and it can destroy the bacteria and and the and produce a bacteria-free environment in the stomach. But when the Helicobacter pylori is contaminated through the food, through the drinks, through the contaminated food and water, and also by close contact with the person, and also by some using utensils where it can transmit with the food to the human, uh, due to or sometimes human to human contact, may cause the Helicobacter pylori infection in the stomach. This Helicobacter pylori take the advantages in the stomach to burrowing the surface mucosa of the stomach and enters into the epithelial cell, where it is present in the, sometimes it is binds with the mucus, sometimes it binds with the submucosa, sometimes it goes into the epithelial cell and enters into the epithelial cell and trapped into the epithelial cell and binds with the epithelial cell with adhesin. So that's why this bacteria cannot be eliminated by hydrochloric acid. So that's why Helicobacter pylori is so much dangerous organism to eliminate. The third one thing is 80% of Helicobacter pylori infections are asymptomatic, and 80% of the Helicobacter pylori secretes the urease, which converts the urea into ammonia and carbon dioxide. This carbon dioxide uh, produce gas and produce sometimes abdominal bloating, and sometimes the Helicobacter pylori produce its symptom in late phase when the gastric carcinoma occurs due to Helicobacter pylori infection, and when it turns over into the metastatic phase, that is through the lymphatics, uh, uh, it can uh, it can ascend or it can descend. When it ascends, it ascends into the supraclavicular lymph node and produce Virchow's gland, and when it descends, it involves the umbilical lymph node and produce cisterna major nodule. Then the symptom of gastric carcinoma arise in this patient. Helicobacter pylori also secretes two type of gene. One is vacuolating cytotoxin A, and another one is cytotoxin associated gene A. This cytotoxin associated gene A is responsible for carcinogen, and it is a carcinogen that involves in the gastric carcinoma, and this vacuolating cytotoxin A, which involves in inflammation, fibrosis, and causes mucosal injury and produce peptic ulcer. In another mechanism, it says that Helicobacter pylori inhibits the hydrochloric acid secretion. because when it converts the urea into ammonia through the urease, this ammonia bind with the hydrochloric acid and produce ammonium chloride, and this neutralize the hydrochloric acid, and depletion of this hydrochloric acid produce achlorhydria. When there is achlorhydria or hypochlorhydria, there will be atrophic gastritis inside the stomach. These atrophic gastritis can turn into dysplasia and ultimately can turn into gastric carcinoma. Helicobacter pylori is another mechanism in case of Bangladeshi people, that Helicobacter pylori itself with host factors such as interleukin 8, human necrotizing alpha, and with other factors such as NSAID and aspirin may causes antral gastritis, and another causes pan gastritis. When there is pan gastritis, it causes duodenal ulcer and gastric carcinoma, and when there is atrophic gastritis, it causes gastric ulcer and duodenal ulcer. This is the another mechanism of Helicobacter pylori causing peptic ulcer disease and gastric carcinoma. How NSAID produce peptic ulcer disease? As far as we know, NSAID or aspirin inhibit the cyclooxygenase pathway. If we start from the cell membrane uh, through phospholipase A2, it becomes arachidonic acid, and arachidonic acid produce the important cell mediators, and which helps in stomach defensive mechanism. One is prostaglandin synthesis and another one is leukotriene synthesis, and this leukotriene synthesis is produced through the lipoxygenase pathway, and this prostaglandin synthesis is produced by the cyclooxygenase pathway. This aspirin and NSAID inhibits the cyclooxygenase pathway to produce the prostaglandins. When prostaglandins are not synthesized, the stomach defensive mechanism is broken down, because in stomach prostaglandin helps in mucus secretion, increase the bicarbonate secretion, inhibit the mucus secretion, and it increase the mucosal blood flow. When these all functions are inhibited due to prostaglandins are not synthesized, as for the prostaglandin is inhibited, and for this prostaglandin, these important defensive function of the stomach are inhibited, which produce or which aggravate the peptic ulcer disease. So this is called NSAID induced peptic ulcer disease. Now, what are the features of peptic ulcer disease? The important features of peptic ulcer disease: sometimes it is asymptomatic, sometimes it produces heartburn or sudden severe burning pain in the epigastrium region or epigastric region, which pain is involved with taking food, or by which have a interference with food, or which interfere with the food, and sometimes it is radiates towards the back, and sometimes it is called the pain is sometimes localized. So this is the important features of gastric ulcer or duodenal ulcer pain. If we differentiate the gastric ulcer pain and duodenal ulcer pain, in case of gastric ulcer pain, the pain occurs by taking food, and in case of duodenal ulcer, the pain is occurred when there is before taking food, the pain is occurred. Why this occurs, we'll discuss. In case of gastric ulcer, the gastric ulcer occurred in the lesser curvature in the stomach, and due to presence of gastric canal over the lesser curvature, the gastric ulcer is produced in the lesser curvature. When there is a food comes to the stomach, the hydrochloric acid secretion is maximum. This food with the hydrochloric acid produce the acidic chyme. When this acidic chyme jumped to the ulcer base, that produce severe pain. So that's why in case of gastric ulcer, there is pain in the stomach after taking food. In case of duodenal ulcer, the pain occurs before taking food. because we know the gastric emptying time, and this gastric emptying time requires 3 hours to comes the food stuff into the stomach, from the stomach to the small intestine. So this 3 hours the patient is on relief of pain. So when the food comes to the duodenum from the stomach, then it produces pain. So in case of duodenal ulcer, uh, in between meal there will be no pain. So this is the important difference of gastric ulcer and duodenal ulcer, if we characteristic the pain. And in case of gastric ulcer, the pain is localized, and pain is burning in nature and sometimes aching in nature and radiates to the back. Not only in case of peptic ulcer disease there will be pain, there will be presence of anorexia, nausea, vomiting, and there will be also a feeling of emptiness in the stomach, and sometimes there will be dyspepsia. So these are the important features of peptic ulcer disease, or important symptoms of peptic ulcer disease. The sign is the localized tenderness, the duodenal points tenderness present over there. These are the important sign. And now the investigation. What are the investigation we can do in case of peptic ulcer disease? We can do endoscopy of the GIT to seal the ulcer and to see the localization of the ulcer uh, by through a endoscope to the esophagus or to the stomach. We can see the ulcer and the characteristic of the ulcer and the condition of the ulcer. Uh, in case of Helicobacter pylori infection, we have to go for some test to see that the patient is infected with Helicobacter pylori or not. One of the important non-invasive test is rapid urease test. This rapid urease test, we use a kit where the kit is presence of urease, and it is invasive test. The rapid urease test is invasive test where we take the biopsy from the two sides, and this biopsy material is placed over a kit, and it converts the kit presence of urease, which converts the biopsy material into carbon dioxide and ammonia, and there is a change in the kit, and its change is a change of pH. Because of ammonia production, the change of color of the kit becomes white to red. So that's why we can diagnose the patient is suffering from peptic ulcer disease, which is caused by the Helicobacter pylori infection. It is the invasive test, the rapid urease test, and it is so much specific, and so much clarity is present over there. And sometimes we go for the non-invasive test. One is the antibody test, and we can sometimes see the Helicobacter pylori antibody in our blood. Sometimes fecal antigen test we can do the fecal occult blood test. Is there any bleeding over the stool? We can see in case of bleeding peptic ulcer disease, or peptic ulcer may be complicated with some other disease such as Crohn's disease, or any portal hypertension, or chronic liver disease, or sometimes diabetic gastropathy. There will be presence of fecal occult blood test. In case of melena, it is present over it is also there will be chance of bleeding in case of esophagitis or malarious syndrome. We can do the uh, or sometimes portal hypertension, we can do the fecal occult blood test. Another important non-invasive test in diagnosis of Helicobacter pylori infection, that is an important test, that is called urea breath test. It is so much important, and we can easily do it. Urea breath test, that means that the Helicobacter pylori secretes the urease enzyme, which converts the urea into ammonia and carbon dioxide. uh, this carbon dioxide produced gas when uh, and this test is produced by we give the carbon 13 or carbon 14 labeled urea to a patient to eat it. So after eating or after taking the carbonated tablet of urea, this tablet goes to the stomach, and where it is broken by the urease enzyme, which is secreted by the Helicobacter pylori, and it converts this urea into ammonia and carbon dioxide. Then after production of this carbon dioxide, the doctor send the patient to a lab to see by breathing how much gas is produced over there. In a normal person, the carbon dioxide is the measure of carbon dioxide in breathing is so much less. Or in case of peptic ulcer disease, or in case of peptic ulcer disease associated Helicobacter pylori associated peptic ulcer disease, this breathing of carbon dioxide is more. So that's why the diagnosis of urea breath test is very important to diagnose this the Helicobacter pylori infection. These are the important investigation of peptic ulcer disease. Now the treatment, or what are the drugs we can use in peptic ulcer disease, or what are the drugs used in the acid peptic disorders. The first of all, we say it acid neutralizer. We can go for antacid to neutralize the acid, and antacid is a combination of magnesium hydroxide or magnesium trisilicate plus aluminum hydroxide. This magnesium hydroxide causes osmotic diarrhea, and aluminum hydroxide causes constipation. So one drug inhibit the adverse effect of another drug, and this combination of aluminum hydroxide and magnesium hydroxide uh, uh, combination is a fantastic combination to control or to neutralize the hydrochloric acid, because antacid causes neutralization reaction to combat the hydrochloric acid. Because these magnesium hydroxide or magnesium these weak bases combined with the hydrochloric acid produce salt and water. When magnesium hydroxide or magnesium trisilicate bind with the hydrochloric acid, it produces magnesium chloride, which is a salt, and water also produced. In case of aluminum hydroxide, it is produced aluminum salt and water. So that's why antacids are the important neutralizing agent to neutralize the gastric hydrochloric acid, and it is called by neutralizing reaction. This antacid combat the hydrochloric acid, or antacid neutralize the hydrochloric acid. The second thing, drugs that inhibit the hydrochloric acid secretion. One is H2 receptor blocker. H2 receptor blockers are nizatidine, famotidine, ranitidine. These drugs are now abolished because from their formulation there is some carcinogen present over there, and these drugs are not used in Bangladesh. Nowadays we used to control the hydrochloric acid secretion, or to inhibit the hydrochloric acid secretion. Our choice of drug is proton pump inhibitor. There are 5 types of proton pump inhibitor: omeprazole, esomeprazole, lansoprazole, pantoprazole, and rabiprazole. These drugs have important role in controlling of hydrochloric acid secretion. How proton pump inhibitor inhibit the hydrochloric acid secretion? At first, the proton pump inhibitor is a prodrug. It enters into the intestine and absorbed to the blood. Then it goes to the stomach and goes to the acidic compartment, where the canalicular surface of the acidic compartment, it is converted into the active compound, that is radioactive thiophilic sulfonamide cation. By producing the active metabolite, active thiophilic sulfonamide cation, it inhibits the hydrogen potassium ATP system by binding with it covalently, and it inhibits uh, or it irreversibly block the hydrogen potassium ATPase enzyme That's why the hydrogen is not secreted to the canalicular surface to the lumen. So that's why hydrochloric acid is not produced, and by this mechanism the proton pump inhibitor controls the hydrochloric acid secretion. The proton pump inhibitor controls the hydrochloric acid secretion 18 to 24 hours. The uh, maximum half-life of the proton pump inhibitor is 1.5 to 2 hours, but their acid secretion ability is up to 24 hours, 18 to 24 hours. So prolonged use of this proton pump inhibitor produce achlorhydria or hypochlorhydria. According to their potency, proton pump inhibitor, the esomeprazole and the rabeprazole potency is more than any other proton pump inhibitor. Proton pump inhibitor, the uses of proton pump inhibitor: it is used in gastroesophageal reflux disease, it is used in peptic ulcer disease, it is used in gastric ulcer for 1.5 months. In case of duodenal ulcer, we can prescribe, or we give the proton pump inhibitor to the patient for 1 month. It is also used in stress-related mucosal bleeding. It is also used in NSAID-induced peptic ulcer. It is also used in null-ulcer dyspepsia. It is also used in controlling of bleeding during esophagitis, or sometimes portal hypertension. So these are the important uses of proton pump inhibitor. Now the adverse effect of proton pump inhibitor. The general adverse effect of proton pump inhibitor: it may cause diarrhea, sometimes anorexia, abdominal pain may occur there. Some nutritional problem may occur due to using a proton pump inhibitor. This nutritional problem is megaloblastic anemia. How proton pump inhibitor develops megaloblastic anemia? Proton pump inhibitor inhibit the foodstuff to release the vitamin B12 by inhibiting, because the hydrochloric acid is responsible to convert the foodstuff to release the vitamin B12. So that's why the proton pump inhibitor inhibit the hydrochloric acid for 24 hours. So that's why no secretion of hydrochloric acid cannot convert the foodstuff to release the vitamin B12. As far the gastric parietal cell secrete the intrinsic factor of Cassel, which helps to absorb the vitamin B12 into the terminal part of the ileum. When the parietal cell is irreversibly blocked by the proton pump inhibitor, it cannot secrete the hydrochloric acid as well as intrinsic factor of Cassel. So this intrinsic factor of Cassel is not secreted, and the presence of body's vitamin B12 cannot be absorbed. So there is a subnormal level of vitamin B12 in the blood, leads to megaloblastic anemia. Okay, there is another potential problem by using proton pump inhibitor. By prolonged use of proton pump inhibitor, it causes interstitial nephritis and kidney damage. Sometimes it will inhibit the osteoclast function and inhibit the calcium absorption, that causes osteoporosis. And sometimes proton pump inhibitor patient may comes to you with hip fracture, with any hip fracture, femur fracture, or bone fracture, or pathological fracture may comes to you due to it causes osteoporosis. Sometimes proton pump inhibitor produce achlorhydria. This achlorhydria causes atrophic gastritis, and this atrophic gastritis can lead to dysplasia or anaplasia, and ultimately leads to gastric carcinoma. So these are the important adverse effects of proton pump inhibitor. Now there are another drugs we give in peptic ulcer disease, that is a cytoprotective agent. The cytoprotective agents are sacral fat, bismuth colloidal compound, and prostaglandin analog, especially the prostaglandin E1. This prostaglandin E1 is called misoprostol, and this prostaglandin E1 is used in NSAID induced peptic ulcer, but this misoprostol is not, or will not be given in a patient in a patient or a pregnant woman with pregnancy. Pregnant women pregnant women pregnant women with peptic ulcer disease, we should not give misoprostol, or the female couple who want to conceive, having suffering from peptic ulcer disease, we should not give misoprostol, because misoprostol causes the intermittent uterine contraction, and may sometimes causes and may or causes, it